Good afternoon. I'm Rose Lee. I'm co-PI of the A2 Collective Coordinating Center. On behalf of the NIA-funded A2 Collective, I'm delighted to welcome you to our pitch training today. We are excited that AgeTech Collaborative, ATC from AARP, is teaming with us to produce the 2026 Pitch Challenge that will culminate in the live pitch competition at the 4th Annual A2 National Symposium that will be on March 20th in Washington, D.C. The 6 finalists that are selected to pitch on March 20th will receive additional coaching by BioHealth Innovation Entrepreneurs in Residence. They're the group that helps NIH and NIA with SBIR, STTR competition training, and they will help prepare the 6 finalists, and the 6 finalists will be considered for competitive entry into the ATC-AARP program. The AARP ecosystem helps startups take their businesses to the next level with key research insights and guidance on user experience, business development, and marketing. The 2 winners will each receive a cash prize sponsored by the RRF Foundation for Aging. Very grateful for their support on this too. This training session is meant to help our most recent 2 cohorts of pilot awardees that were awarded in 2025 prepare not just for the pitch competition, but we hope also improve how you communicate and network with investors and other stakeholders. These are skills that we think you can put to use at the symposium next year, including during the special programming we have planned for you, such as the speed mentoring session with funders and accelerators, the poster demo sessions, and other networking opportunities over lunch, receptions, and breaks. With support from RRF Foundation for Aging, we're also partnering with the Gerontological Society of America, GSA, to offer you training on communicating with policymakers and reframe aging training to avoid age biases and framing. Our Reframe Aging training is a 3-part training opportunity. There's 2 virtual sessions, followed by an in-person on March 18th in DC, with the first session happening next week, December 9th at 2 p.m. Eastern Time. So we hope you'll sign up for that opportunity as well. Today's training will be led by Dr. Phillip Phan, a co-PI of the AITC and the director of the AITC Networking and Mentoring Core. He is the Alonzo and Virginia Decker Professor of Strategy and Entrepreneurship at the Carey Business School, and he has a joint appointment as Professor of Geriatric Medicine and Gerontology in the Department of Medicine, and is also a core faculty member at the Armstrong Institute for Patient Safety and Quality. I think this combination of background is quite rare, so we feel very blessed to have someone of his background to be helping with this. His research focuses on the commercialization of biomedical technology and health services research, particularly in cost effectiveness and AI applications for patient care. He's also a certified Professional Association of Diving Instructors dive master, which includes being trained as a rescue diver. I think he has said before he considers this as exhilarating as getting a JAMA or Nature publication. So with that, I'll turn it over to Phil. Thank you.
Thank you, Rose. Welcome, everyone, and congratulations to the Grant Year 4 and Year 5 awardees. I'm really happy that you're here with us. As Rose mentioned, the purpose of today's workshop is to help you prepare to pitch competitively for hopefully being selected for the live pitch event in DC next year. But I also want to mention that actually everything that you do in the commercializing of your technologies really ought to be reflectable and reflected in a concise pitch. And I talk about why that's very important. And the workshop today is, well, on the one hand, focused on helping you prepare for the live pitch event, for competing to be in the live pitch event. I would like you to think about this workshop as general preparation for pitching, because you will be doing a lot of pitches. If you're serious about commercializing your technology and taking your invention forward and solving the problems that you're trying to solve, which you will not be able to do if you can't get products and services to the market, at least not in the world that we live in, you're going to be doing a lot of pitching. right? You're going to have to convince oftentimes a skeptical audience, a skeptical investor that what you've got to offer is, the best thing that is possible, and that they should invest, even if they're not interested necessarily in making money. But they should invest with you because solving that problem is important to them as well. So the pitch training really is general training for these kinds of circumstances. So a little bit of housekeeping, and this, Rose has already talked about many of these things, so they're really in here to memorialize what Rose is talking about, because the slides will be, so you don't worry about trying to, take a lot of notes. Take the notes that are relevant to yourself, but the slides will be shared with you by Alice Wang from Roseley Associates after this workshop. So ultimately, what you will need to do is to deliver by January the 14th at noontime a 5-minute pitch that, depending on what you're trying to do, include a product demo and a 10-slide maximum pitch deck. So these are all maximum numbers. You can pitch shorter than 5 minutes. You can submit a slide deck that's less than 10 slides. And the purpose of this is for us to essentially pick the 6 finalists that will be live pitching at our event in DC, for the prize, but really more importantly for exposure of your idea. Because once you get past the bench and, allowing for intellectual property issues and those kinds of things, which you should think about sooner rather than later, but setting that aside, really the purpose of commercializing your venture is going, or one of the key activities in commercializing a venture would be to expose your idea to as many people, to as broad of an audience as possible, so that you can get supporters, backers, cheerleaders, enthusiasts, right, behind you. That's the way you're going to ultimately be able to get it to market, right? Keeping your idea secret is not the way to get it to the marketplace. So Rose talked about the prize for the cohort winner and what you will get in terms of support from BHI as well as AgeTech Collaborative. Now, the AARP AgeTech Collaborative is very interesting. This is an accelerator that AARP has put together. It's a fairly recent innovation, and the purpose is very much like what we are trying to do, which is to bring in innovations, in the technology space to market to benefit older adults. Okay. What they've also done, and I'm doing a little bit of advertising for them because I'm very excited about what they do, is they actually have a pavilion at CES, the Consumer Electronics Show, which is the largest consumer electronics show on the planet. In Vegas, right? There are tens of thousands of people that come to this thing, and they have a pavilion where they will showcase what they do in support of the older adult and some of the technologies that they back. So, it's possible, there's no guarantee, but it's possible that if your technology is innovative enough, attractive enough, impactful enough, that it might end up on the pavilion. I will let them talk about that, separately. But I get very excited when I see these kinds of opportunities because I think they are very rare, especially for startups. And to be able to face the consumer so quickly in your startup journey is a tremendously powerful opportunity. So let's talk a little bit about pitching your venture. And I've planned 2 short breakout sessions today. And then depending on how far we go in terms of timing, we'll try to take breaks. It's about a 2-hour workshop. So, feel free if you need to go get a drink of water or something to do that. And then, I'll try my best to give us breaks so that we don't get exhausted at the end of 2 hours. What are the learning objectives? So I'm going to talk about the key elements of pitch deck. Now, some of you may already have a pitch deck, and so you can use this as a check on what you have in the pitch deck. The pitch deck that I'm going to be sharing with you, the template of the deck I'm going to be sharing with you is going to be sort of the full template, right? You're not going to necessarily need to use every single slide, for your 5-minute pitch. You might not want to actually. And certainly in terms of the competitive entry into the AARP's um, uh, um, accelerator, open mic competition, you're not going to be able to, use all of the slides. But this is the full set. And so you should prepare all of your research to back every single slide in the deck and have it ready to be adapted and used as the situation fits. Okay. Now, your first draft of your slides, obviously not going to be the last draft, but I'm going to be talking about every element of your pitch deck to just give you all of the materials necessary for you to be fully prepared, regardless of the situation that you're facing in terms of who and where and when you pitch to. I'm going to talk a bit about how to make a case to a skeptical audience, because I think when you pitch, you always have to take the position that you are going to be pitching to a knowledgeable but skeptical audience, right? These are investors, and typically we pitch to investors. That's why we do these things. These are people whose time is very valuable, but more importantly, who have seen a lot, right? And so, you might think that you have the best things in sliced bread. You might think that you have a unique perspective on the problem that no one else has seen before, or that you're particularly qualified to assess and to solve. And that may or may not be true, but it would be your job to convince your audience that that is in fact the case. Right. And then, towards the end, I'm going to very, very briefly talk about some best practices on formatting and pitching a deck. These are things that you can easily find on YouTube. There's no secret sauce to this. A lot of it really is around good principles of communication, right? And if you think about some of the best advertisements that you have seen, either online or on broadcast TV, I think you will sort of get it once I tell you what the key elements of a good pitch are. So let's begin with what a pitch is. Now, I believe there is a chat box, and so feel free to put your questions in the Q&A, and then from time to time I'll sort of take a look at it and see if there are any questions that I should be answering. And if I miss, I'm sure my colleagues at RLA will be more than happy to draw my attention to it. All right, so let's start with some definitions, right? What is a pitch? When we talk about pitch, we are specifically in the context of what we are doing here, talking about a very concise articulation of a problem and its solution and why it's valuable. And the reason you want to talk about why it's valuable is because you need to make a case that the problem you have identified is significant to a particular audience, and that audience considers it important enough that they're willing to pay to solve that problem. Like, it's painful enough that they need to solve it. Okay, so that's basically what your pitch is designed to do, is to convince the investor that you have an angle on a problem for which you can make money. All right, I'm going to repeat this over and over again. If you cannot make money from your idea, then it may not be an idea you want to commercialize. It doesn't mean that the idea is not important. It doesn't mean it may not be good. It may mean that there could be a different route to getting the idea, realized or instantiated, right? It might be an idea that is suitable for a government program, for example, or a nonprofit foundation. But ultimately, at least my view is, and I think certainly the view of the commercial world, is that if no one is willing to pay to solve that pain point with your solution, then you need to rethink the solution, or maybe rethink the way you're defining the pain point. Okay, and we'll talk about that. And I'll refer to an earlier workshop that I did a couple of weeks ago around precisely this problem. And you can take a look at that workshop to get a more detailed explanation. Typically, a pitch is delivered to investors and funders, right? So it's very important that when you pull a pitch together, that you have an audience, like the profile of the audience in mind. Like, who are you talking to? Are you talking to angel investors? Are you talking to venture capitalists? Are you talking to a banker? Are you talking to friends and family? Are you talking to a government policy maker, a grant maker? Are you talking to an SBIR program officer, etc., right? Who are you trying to convince to back your idea with time, money, resources, attention, etc.? And typically pitches are around the range of 5 minutes. For the purposes of this competition, your pitch has to max out at 5 minutes. Essentially, we stop watching after 5 minutes, so you have to get it within 5 minutes. There are some pitches that are a little bit longer, 7 or 8 minutes. A lot of pitches are actually much shorter than that. And the reason is because a pitch is a gift of time. All right. So you want to come from the perspective that when you are given an opportunity to pitch, it's not just a task that you have to fulfill, right? It's a gift. How valuable is that gift? Well, think about this. A 60-second prime time slot on network TV is about $500,000 to $700,000, right? Prime time. So 5 to 7 p.m. at night, 9 to 10 p.m., etc. $500,000 to $700,000 for 60 seconds. Multiply that by 5. That's how valuable potentially your pitch is. This year's Super Bowl ads was about $60 million for a 60-second spot. Now, I think it'll be hard to argue that your pitch will be as compelling as a Super Bowl ad. But I would argue that if you're trying to solve a problem in which millions and millions of people suffer from in healthcare, that it might be more valuable than a 60-second Super Bowl ad. All right. So in any case, the point is that time is money, and this is the kind of money we're talking about. You're given 5 minutes of that. 5 minutes is a long time. That was 10 seconds. Imagine what you can do in 60 seconds and imagine what you can do in 5 minutes. So it's a huge amount of real estate that you've been given. And so when you prepare your pitch, make sure that you are very strict with yourself, right? To put in the most important information you're trying to communicate. A pitch is basically a communication exercise. And most importantly, that you get the message across that you want to get. Because just because you say something doesn't mean that your audience, right, your target has actually heard what you want to say. So all that means is that when you put your first draft pitch together, it should never be your final draft, right? A first draft is literally that, a first draft. Those of you who write papers understand this, right? I mean, a typical submission to a peer-reviewed journal would probably go through, at least for me, it goes through about 8 to 9 revisions before it gets submitted the first time, from first draft to submission. And a pitch is probably even more, requires even more work than that, right? It has to be very precise, very, very, very impactful, very compelling. Okay, so let's talk about, so first of all, let me see, are there any questions? No questions. All right, so let's talk about some key elements of the pitch deck. So here are typically in a pitch deck, sort of 11 sections, right? Now, each section could be one slide or it could be multiple slides. There is no hard and fast rule about this, but at minimum, each numbered section should be one slide. If you can get it down to one slide per section with an 11-slide deck, you're really good. It doesn't mean you can't have a lot more detailed information in there, right? The financials, for example, might require you to show some of your assumptions, might require to show your modeling. All that could be backup support slides, appendices, etc. But in your main deck, right, here are typically the sort of key 11 elements to it. And we'll go through each of them in turn, some in greater detail than others, because they are a little bit more important, at this stage of the game for you. So let's talk about the unmet need. Now, 2 weeks ago, I did a 1-hour JJITC seminar on the unmet need. I'm not going to take an hour to do that here. I'm just going to pick up some highlights and why that is like the linchpin of your entire pitch. Actually, the unmet need, or understanding that, or defining it, or nailing it down, is the underpinning of your entire business venture, right? I know that many of us who come from the technology world, who are scientists, who are investigators, who are clinicians, tend to be focused on the solution, on the technology, because we think that's what we spend our time working on, right? So that's like our thing, our baby. And so we want to tell the whole world our baby. No. I mean, ultimately you will, but that's not really the point. The point is to tell the world what problem you're trying to solve and why that problem is so important. So that's the unmet need, right? So let's start there, and then we'll go through each of these, and we'll do maybe an exercise or two. And the first exercise will be the unmet need statement, because it takes work to nail that down, and I want us to experience that a little bit, at least today. All right. So in the unmet need statement, the first thing you want to describe is the problem. So you want to articulate the problem, right? If you can do it in 2 sentences or 3 sentences, then you're fairly sure that you have the problem well defined. And what I find typically for a lot of entrepreneurs, especially those that are more technology forward, right? So you have a hammer and you're looking for a nail, right? So I sort of think of technology forward, or sort of solutions forward ventures like that. And so I've got this hammer and everything looks like a nail, right? And that may not necessarily be the case. And if something that is not a nail looks like a nail and you try to hit it with a hammer, you basically have a mismatch, right? And that's why ventures fail. Instead, you want to think about the nail, right? Are you looking at a nail or a screw or a hook, or what is it you're trying to do? So the first thing is describing the problem very precisely. And then, of course, you need to talk about how big the problem is and how fast is it growing and why is it important. And these are related, but they're very different aspects to the problem, right? How big the problem is will give you an idea of how many people or the size of the target market, in a way, the size of your initial opportunity, right? If the problem is significant enough, if it's significant to enough of an audience, then you potentially have a market for your product or your service, right? Now, the problem may be a very important problem, right? But there's maybe not a very big audience for it, but it's important enough that for this group of people, that problem has to be solved. So if you're looking at a problem that must be solved, but it's only among a small group of people, that's still an opportunity there. That simply means that they're willing to pay a lot to solve that problem. And so you need to sort of figure out what is it they're really looking for in terms of solution and designing it very precisely to solve the problem for them. The how fast is it growing a dimension to the problem is your scalability, right? How fast can you scale your enterprise once you have a solution out there to the point that it is economically sustainable, but more importantly, economically, financially attractive for an investor? Because an investor is going to have to make a decision. Do I bet my money with you, or do I bet my money with someone else? If I bet my money with you, when am I going to get it back? And how much more money can I make out of it, right? That's sort of just the bottom line question that investors are going to ask. And so how big the initial problem is important for that. But really, what's really important is how fast is this problem growing, right? What's the future for it? And at what point can I, get my money back? That's really important. If the problem is big, but it's very slow growing, then, it might be a sort of good short-term investment, but that's going to change my calculus, right? It's going to change what I would require from you as the inventor in terms of the attractiveness of the financial opportunity, the money that you can make initially, not the money that you can grow. All right. So now once you have sort of identified the problem to solve, you need to state it in a way that makes sense, to not just the investor, but to a technologist and to adopters, of your solution. So the way to state a problem in a way that is compelling is you want to sort of hit 3 important elements, right? Number 1 is the problem, like what is this problem, right? Number 2 is by whom and where, right, is the problem experienced. So who experienced the problem and where, and sometimes when. So the context, right? The audience and the context in which the problem is experienced, right? Is it an ongoing thing? Is it intermittent? Is it very chronic? Is it very emergent, etc.? Like, what is it about this problem, right, that makes it very compelling, and to whom? And is there some pattern in terms of when it occurs that matters to the design of the solution. And then ultimately, you need to talk about what the desired outcome is if the problem is solved. So if the problem didn't exist, what would be the outcome? Like, what would the world look like? Or if you solve the problem, what would the world turn into? Okay. So notice that when you articulate an unmet need, there is no mention here at all about a solution, right? You typically use the word a way or a method, all right, or an approach, right? You keep the discussion of the solution at this point out of the picture because there are many solutions, there are many ways of solving a problem, right? If you can articulate a problem, it's unlikely that you are the only one that has identified the problem and articulated and identified the audience for it. It is unlikely. There are very, very few completely new to the world novel problems, right? There might be novel solutions, but there are very few novel problems. A lot of the problems we have just remain unsolved, maybe because the technology is not ready, maybe the way the problem has been defined is not quite precise enough. For the target audience, maybe the problem is evolving, etc. So problems continue to exist for a lot of reasons, much of which may have to do with the solutions themselves. So you don't talk about the solution. You just want to nail down the problem statement, the unmet need statement, right? Now, the problem to be solved can fall into three categories, right? The pains that are being experienced, the gains that are hoped for by the target audience. So it may not be a pain, but it may be like a performance gain or some way of living better, of doing something better. And then, of course, the job to be done. So typically, when you talk about a job to be done, you're talking about something that your target audience has to achieve in order to get along in life, in order to get their work done, in order to manage the family, in order to give care to a loved one, whatever the job has to be done, right? And the problem that they're facing in trying to get that job done. So typically problems fall into one or more of these categories. And so you want to be very clear about what pain points you're trying to address or what performance gains you're hoping to achieve, right? In getting the job done for your target audience, for your customer. So again, the unmet need, very critical, whom and where. So in some of the other courses that you might have been to, they talk about the total available market, the serviceable obtainable market, and the serviceable available market, right? The TAM SAM-SONG. These are very popular terms. If you've not heard of it before, it's very easy. Just Google YouTube and you get long drawn lectures about what the TAM SAM-SONG is. Basically, what it is a definition of your market size, right? The TAM is the total market. It's all of the people in a defined region, say in the United States, right, that of a certain, a category, a certain age group, maybe a certain gender, if that's relevant, maybe a certain social economic, group, if that's relevant to your problem definition. Everybody that has potentially this problem, all right, or can experience this problem. Now, it is very seldom that you're going to be able to design a solution that addresses everybody, right? I mean, the hope is you can do that. It's very seldom you can do that. And you certainly are not going to do that in your first product, the first version of your product. Instead, what you're going to do is you're going to try to narrow down that definition to a serviceable, obtainable market. So the obtainable market may be region specific, it may be demographic specific, it may be specific to a certain type of user. It might be specific to a certain subset of the problem statement. All right. Essentially what we call the beachhead market, right? So these are individuals or institutions or organizations for which with the most immediate need that your first version of the product can meet, right? Without adding more features to it, without having to do more things to it in order to make it attractive. So understanding that SOM is going to be critical because that number, and all these things have to be quantified, that number is going to determine your top line, the revenue for your business starting out when you launch a business, what that revenue is going to look like, and then you grow from there, hopefully. Okay. And then, of course, that third piece I talked about, which is the desired outcome, right? So the desired outcome is, for example, there's an example of this, to be able to initiate and complete daily tasks consistently. I'm going to give an example of ADHD among older adults, right? Because that's the population that we are interested in, that the program, funds pilots for. And so ADHD among older adults is not always well characterized. It's not because, older adults with lots of lived experiences oftentimes learn how to manage their ADHD symptoms, right? So it's not necessarily well characterized. It's usually underdiagnosed. But it can be difficult, to live with. And one of the problems with ADHD is the ability to initiate and to continue working on a task, right? So if you are not able to initiate tasks, or you initiate many, many tasks and you don't complete it, then you don't have actually necessarily have a very high quality of life, right? At home. And so if you solve the problem either of diagnosis or treatment for ADHD among older adults, you might allow these individuals to have a higher quality of life because they can initiate and complete daily tasks more consistently. So that is what I mean by a desired outcome, right? You have this problem, you have some intervention, and the result of the intervention is, in this case, a higher quality of life on some aspect, not just in general higher quality of life, but higher quality of life because they're able to do something better than without the solution. Okay, so what you will notice throughout this entire workshop is one has to be very precise about what one is talking about in order to build a compelling case for your venture idea, in your pitch. So here is an example, right? It's a very detailed, very precise example of an unmet need. So this is from an actual project that we did. It's not in the older adult space. It's not in the geriatric medicine space, but it's very typical of the kind of unmet need statements that we might encounter in this example, our biomedical engineering program, but it could be any program, right? So the unmet need statement. So take a look at this sentence and then sort of break it down into its different parts of it, right? So first is the description of the problem. Resection of the upper lobe in the lung is a very complicated procedure in lung surgery, the most complicated, right? And it requires, and because it's complicated, it requires patients to be anesthetized for long periods of time, right? So if you're anesthetized for long periods of time, one potential complication of that is long-term recovery. And if you're immunocompromised, you're particularly exposed. So that's sort of the problem, right? So I need to solve this problem. How can I solve this problem? Well, the different ways of doing it. I mean, there's nothing in here about how you're going to solve it or what you're going to solve it with. But you can sort of imagine that when you articulate a problem like that, there are many aspects to how you might solve the problem, how you might design a solution. For example, you might change the procedure. You might make it less complicated. You might use a technology like robots to help you with that, to maybe reduce the potential for mistakes. You might, find a way to speed up the procedure. If you cannot simplify it, maybe speed it up so that you don't have to anesthetize the patient for long periods of time. Or you might find some kind of a way of making sure that patients are less immunocompromised, prior to surgery. So some kind of a pre-op, treatment regime to solve that problem, if possible. The point is, when you articulate a problem in as specific of a manner like this, you can immediately start to imagine that there are different approaches to solving it. Now, which is the right approach? Who knows? That's going to depend on who's designing the technology, what is most approachable, cost efficient, etc., right? Least risky, so on and so forth. What can be actually certified? What is accepted? So the unmet needs statement is like that, right? Surgeons need a way to reduce procedure time to lower morbidity risk during post-op recovery. So again, it's very specific. So you need a way, unspecified at this point, to do what? To reduce procedure time, because it is the procedure time that creates this need for anesthetic for long periods of time. And the outcome that if you can do that is to lower morbidity risk during post-op recovery. So it's not during the procedure itself, because you have to be anesthetized during the procedure, right? There may not be a clinically safe way to do the procedure without anesthetic. So you want to focus on the post-op recovery part of it, right? Can you help patients get out of the PACU faster, get into the ICU faster, etc., and so that they can put on support. So this is an example of an unmet need statement and this statement was the result of many, many iterations, right? Many observations, many questions, many interviews, with surgeons, with nurses, through the whole perioperative process. So the unmet need statement is like that, right? A method to continuously and accurately detect cognitive decline, which is sort of pretty typical in the older adult population. I mean, it's a typical problem in older population, to personalize care and delay the progression to dementia. All right, so here we've got a problem statement about MCI, the need to detect or to predict MCI, maybe even pre-symptomatically, don't know. And what's the purpose of that? Well, the outcome is if you can do that, you can personalize care. So you're going to think about, what do you mean by personalizing care? So that you can delay progression to dementia. So if this thing works, if whatever this thing works is, you could actually give patients longer, higher quality of life prior to onset of dementia, or maybe even forestall or prevent dementia. Maybe, hopefully, right? So what I need you to do is look at it and say, how would you improve this to make the statement more specific, so that you could actually begin to approach what might look like the elements that would go into the design of a solution, because that's what unmet need statements are designed to do, is going to help you decide what are the key elements to a solution if you're looking for a solution, right? And by the way, just as a point, the unmet need statement is going to be the foundation for your entire pitch. It's going to be the foundation for your market sizing, determining the size of your market, your entry point in the marketplace, your revenues, your costs, obviously, because it's going to determine the design of your solution, which will determine how you're going to market this thing. So you can see that everything gets connected to having a very well-defined, very precisely defined unmet need statement, right? So you're not going to get away with saying that, there are, however many million older adults in the country, and some percentage of them have mild cognitive decline. I mean, that's might be true, but it doesn't really help you define what the exact unmet need is. All right, guys, this is an iterative process, right? I mean, we spent a lot of time dealing with this piece of it. And those of you who are interested can look at your institution's I-Core program. So the I-Core is a program that was initially funded by the National Science Foundation, and now is part of many of the NIH SBIR programs. But a lot of universities have them. It's a very interesting program because it gets you into the field very, very quickly. In the National I-Core program, they require you to talk to 100 potential customers. And that process, painful though it may sound, is actually what's quite important in coming up with the unmet needs statement. If you're working alone, or if you tend to work alone on your pilot project, make sure you find opportunities to pull the team in. Good teams have, team meetings pretty regularly, lab meetings. If you're not running a wet lab, that may not be a standard practice, but it's always good to have, as a bit of a sidebar, regularly scheduled meetings among the team to talk through things like that. And if you can't if you have a big team, you can't do like a big team meeting, have subgroups that will work on your problem. All right, so that's the unmet need. So the next slide would be, or the next segment would be the solution. Now, when we talk about the solution, there are certain aspects of presenting a solution that are better and certain aspects that are not so good, right? I will tell you that as a scientist, typically we like to present the solution in terms of what we understand, because we've been working on this thing. If you're working on a biomarker, you want to talk about the entire history of why this was important and what was the science behind it, the evidence, and all that is fine, and they can be backup slides. But when you're describing the solution, even though you're talking to a sophisticated audience, you want to be able to describe it non-technical language. Why? It's not just for the benefit of the audience, it's for your own benefit. Because if you can do that, it's like a mentor used to say to me, describe it so your grandmother can understand it, right? If you can do that, then you know you nailed it, right? It isn't about dumbing down. It's actually about having a very sophisticated grasp of the solution in such a way that you can describe it to a teenager and they get it. They know what you're trying to do. Because when you can do that, then it's very compelling. That means you can sell the solution. That means you don't have to work so hard to convince someone that this thing, is real or potentially can be real. So what does that mean? In a presentation, in a deck, you typically want to use visuals, right? You don't necessarily want to talk about the solution, even if it's like a process improvement, right? Where you don't actually have like a thing to show, but you can show a process map. You can show a before and after picture of a process map, right? But this is the way, care coordination or care uncoordination happens. We're all very familiar with that. And with our platform, with our solution, this is the way care coordination can look, right? Here is what the future looks like. And so you want to sort of explain this with visuals, wireframes. If it's an app, all a wireframe is a visual representation of what the app looks like, how you interact with it. You might want to show a couple of wireframes and how the app sort of gathers information or provides information or does something for the user. Or even better, if you have a product demo. Now, I will say this later on at the end of this workshop, is if you're going to compete in the AARP accelerator open mic competition, you do have to have some type of a prototype. It doesn't have to be a mature prototype. Even if it's conceptual, you need to be able to visualize it, right? People have to actually see what you're talking about, because that's the clearest way to make an argument that you know what you're doing. Okay. So some vague description of what the solution is not good enough. You have to try to instantiate it in some form. So now what the solution also does is articulate the value proposition, right? Because built into the solution, its form factor, its what it does, its performance, its functionality is the solution to the problem, right? This solution does X because doing X solves that problem. And so it should be somewhat intuitive. A good description of the solution also would make it obvious why the customer would buy your product, because your solution is unique among all and there is a slide on the competition, so you can go into depth in there. But at this point, by showing a compelling picture, if you will, a graphic of your solution, you are also conveying the idea that this is something that the customer will want. So spend a little bit of time on the form factor, if it's a thing. If it's a platform or a process improvement or a service, spend a little bit of time, describing the pain points that the customer is currently feeling and how that pain goes away. So try to take your audience, on this journey where you put them in the shoes of the provider, the patient, what have you, in navigating the difficulties of this process and how your solution just makes it so simple for them, right? So that's going to be your solution slide, which is answering the question like, what is it? Like, what are you talking about in terms of solving my problem? And then, of course, why is it better than other solutions in the marketplace? So it's your product compared to other products as well. So that gets a little bit more built out, more detailed in a competition slide. Right? So here's sort of an example. And again, it's a very generic example. This is a combination, service and thing, right? So here you've got a thing, which is a wearable that collects data. And what you're trying to do is you're trying to risk score this patient using the AI. And the risk scoring will then allow for some kind of an intervention to happen. Okay, so presumably what you have is you have a way of improving care by early detection. And you can change the words in there to make it a little bit more specific to the problem you're solving and this product that you're trying to sell. Now, it probably will not be the wearable because there are lots and lots of wearables out there. And by the way, the AITC program, the A2 Collective program, does have a partnership with Samsung. Samsung makes a very, very good wearable. And I know of at least 2 projects that are accessing the API that, to collect data to use for their AI algorithms, for, certain detection of certain biomarkers. So this is quite real. Right? There are lots of these things out there. And so what your problem will be is to differentiate yourself from all of these other wearables, from Apple and all of these other companies that are trying to do a similar kind of thing. And the way you're going to differentiate it is being very, very precise about what unmet need you're trying to solve, which then will say something about the algorithm or the intervention that you're trying to support with this early detection, and why your technology is better than what currently exists out there. So you want to sort of show it this way, right? You don't want a lot of words because this is going to be important. It's going to demonstrate you know what you're talking about. Now, are there any questions about that on this slide? So you have the unmet need, then you have the solution, right? They tend to come in together in pairs. So now in the solution, so when we talk about a value proposition, what we're really saying is the point at which the solution meets the need. So you see the need, you've got gains and pains, and then you have these things that the customer has to do, that the patient has to get done, making an appointment, getting medication filled, or a provider making up clinical notes, what have you. So they have things that they have to do to basically get along in life, right? And these things are implicated by either barriers to prevent it from being done efficiently, well, costs, in a least costly manner, or that these things that have to be done could potentially be improved. They can get it done better, faster, cheaper, right? So pains or gains, right? And your solution is tuned to solve one or more of these need dimensions, right? So it's either pain relievers or gain creators, and it's embodied in the form of products and services or some combination of products and services. So think of the value proposition as this meeting point. You have a value proposition when those solutions that you're thinking of precisely addresses those pains and or gains that are articulated in your unmet need statement. Okay, that's value right there. If you have a solution that doesn't address that precisely, directly, then you don't have value. You have a solution, you have a hammer, you haven't found the nail yet on which the hammer is most effective. Okay, so when we talk about value proposition, that's really what we're talking about. It's nothing more complicated than that. Now, here's the thing. How do we know it's valuable? How do we know it's valuable? How do we know that what you've got to offer is something that the customer wants? Well, because they're willing to pay for it. So that's another thing that we need to address, right, in the deck, in your pitch deck, which is, yes, I've got a solution. Yes, I've got an articulation of a problem. And by the way, I found a paying customer. I found someone or a group of people or a demographic or an institution, a hospital, the government agency. I found an audience for this thing because they're willing to pay for it. Unless they're willing to pay for it, you don't have any value, because value is a simple economic definition of economic value, right? Price. So a lot of your research around the size of the market and your serviceable, obtainable market is finding that group, that demographic that is actually willing to pay, and then figuring out in your market research how much they're willing to pay and at what point they're willing to adopt. So this willingness to pay, WTP, is a large part of a lot of the research you have to do in order to figure out the total dollar value of your market, right? Because the dollar value of your market is simply the number of users multiplied by the price they're willing to pay per unit or per use or per service. Okay, sometimes that's easy enough to find if you have, let's say, a service that is covered by, CMS or insurance. There's a code for it. There's a reimbursement amount. It falls within the specific reimbursement categories. You can find that out, right? A lot of times you don't have that, especially if it's fairly new. In the AI space, it can be particularly challenging because AI embedded devices may perform better, but if those devices already exist, if they're already doing the job, then making the case that your AI algorithm in the device does a better job, results in better outcomes or lower costs, is going to be an additional step you have to make. All right, the next piece is traction. Now, I put this up here because and I'm going to keep referring back to the AARP Open Mic Pitch competition because they actually require that. And that's actually a fairly important slide in any case, because what traction is what have you done to de-risk your venture, to de-risk your startup, right? So think of traction like this. When you start with a concept, a sketch on the back of a napkin, an articulation of an unmet need, and a solution to that unmet need, you have an idea. And ideas are just ideas until they are realized in some specific form, right? Until you find a market for it, until you figure out how you're going to, manufacture the product or build a service and then sell it, right? So the process of doing that is very risky because it could fail at any point in time. What if your estimation of the size of the market is wrong? What if it's only a third of what you thought it was going to be? What if your estimation of how much it would cost to make the thing, to build the thing, to innovate the thing is off? It's maybe twice or three times what you thought it was going to be. So there's risk in the entire commercialization journey from concept all the way to market launch. So traction is making the case or providing information on the steps you have taken and what you have achieved in order to reduce the risk of failure at each step. So if your journey is a multi-step journey, there is risk at every step. The risk in the first step is inherently the highest relative to failure compared to the risk in the last step just before market launch. Because before you launch, you have a product, you have an identified customer, you have a financial model, etc., right? And it's just a matter of launching the thing and seeing what happens in the marketplace. It's still risky, but it's a lot less risky than the point at which all you have is a concept. Okay, so traction basically says that I've got some early wins. I have maybe an initial sale of a prototype, or maybe I have a partner that is willing to pay for some piece of the development because they see what I'm doing is valuable to their operation or what they are trying to do. Maybe I'm building an app and I have some traffic to my website in the initial draft version of the app. And downloads that go with that, right? Maybe I'm seeing some growth in terms of interest. Maybe I'm developing a technology, in which case technology development go through very specific milestones, right? From a concept to wireframe to prototype to alpha, beta, etc. If we're talking about an app, if we're talking about a drug, then those are very well-defined milestones because drugs are heavily regulated in terms of the development cycle and the kind of data that is needed for marketing approval, et cetera, et cetera. So, along the way, you want to make very, very clear that you're doing things, you're sharing with the investor the things you're doing to de-risk it. The more you're able to de-risk your venture in the eyes of the investor, the more investable you are. So then their problem, and that's their problem, is deciding how much they're willing to risk with you and what rate of return they require. And every investor has their own internal metrics to judge that. But you're trying to help them make that judgment by basically saying to them, what you have is a high potential venture that has been substantially de-risked because you've done all this work, right? To reduce the uncertainty that is inherent in the development process. So early funding that you have done, right? So, for example, if you win the pitch the A2 collective pitch competition in DC next year, that's a huge step, right? It's not the money, it's the fact that it has actually received enough validation from an audience that money has been sort of awarded, right? That's traction. Okay. And so actually, for a lot of ventures, early stage ventures, entering business plan competition, now they take time and they take some resources, but entering business plan competitions and successfully competing in them is actually a very, very good form of traction, right? To report, right? Winning SBIR grants, government grants, getting foundational support, strategic partnerships, right? So if a large pharma or a large device company or a healthcare provider or a healthcare network comes to you and says, we heard about what you're doing, we like what you're doing, can we talk? That's traction. Even if they don't invest, the fact that they are showing interest, you report that, that's traction. Okay, press allocates, all this stuff, right? So what you want to do with the traction slide is you want to tell a story, right? It's not a random collection of things that happen to you, because you don't want to convey the idea that you just got lucky, right? Like, you want to convey the idea that you're very deliberate, that you're thinking about how to reduce risk over the course of your journey. So you want to use data, image, videos. And this, by the way, is a general point for all of your slides. Some of them might be data heavy. You want to try to make it visually appealing, even if it's data heavy. You'd certainly, as much as possible, don't want to make your slides text heavy, right? Because you don't want people reading your slides. You want them listening to you. And by the way, very important thing with traction is you got to be transparent about setbacks and recovery plans, right? So every investor understands that there's no such thing as a smooth, perfect venture that never experiences setbacks. You're going to experience setbacks. The key is, what did you learn from the setbacks? How did you pivot from the setbacks, right? How did the setbacks make you better, right? How did the setbacks change your milestones so that they are more achievable, they're more realistic, that you get closer to it? So that's how you use setbacks. And I personally would be very suspicious of any venture that says, "Oh yeah, it's been perfect, no problems." No, it almost never happens. And if it does, and if it's true, in fact, that it never happens, then you probably didn't engage in it deep enough. You weren't working hard enough to actually, take this thing forward. And most venture capitalists will avoid that type of a venture, because they rather you learn from your mistakes so that the next mistake you make is less costly and more likely to lead to success, right? They want other people funding your mistakes. They don't want to fund your mistakes, but that's going to happen. So here, I'm not going to go through this visual representation of how you build your traction slide, but it's the same thing that I talked about just visually, right? Keep it simple, tell a story, make sure that, the metrics that you use to measure traction are consistent with your development plan, right? If you're going to develop a drug, then you need to put in there how you're going to go through the FDA approval process, what the milestones are, how much money, ultimately you're going to need to go through each step. What have you done in terms of animal studies, safety studies, to get you to the point where you can get your initial meeting with the FDA, etc. So that's the path you're going down. Again, it's very well defined. You need to show that, because you need to convince your investor that you know what you're doing. So it's all about, remember that 60-second, $60 million ad, Super Bowl ad, right? It's all about selling your idea. It's all about making such a compelling case that the investor says, "Can we have a second meeting? Can we have a private meeting? I want to learn more." Ultimately, when you pitch, certainly the first time you pitch, that's what you want. You're not necessarily trying to get all of the money you're asking for. You're going to ask for money. Typically, when you pitch, you're asking for the next meeting, right? Because maybe only a third, if at that, maybe 20%, of a set of initial pitches get a second meeting to a typical venture capitalist, because their time is valuable. All right. So the next piece is the opportunity. So let me just go through this. I talked very quickly about the opportunity, the Tam Sam song. So here is an example of that. I sort of briefly mentioned that. So in this case, the total addressable market are all older adults with ADHD in the US. So it's, again, fairly well defined, but it's big, right? It's all older adults. And then you've got a smaller set, which is older adults that are diagnosed. Remember, I said that actually diagnosing ADHD among older adults is, first of all, they don't usually, go and get a diagnosis unless there's something very seriously wrong. So they're probably underdiagnosed as a population anyway. So the SAM would be the addressable market is the older adults that are diagnosed, in this case, within the state of Maryland. But you could say maybe in the US, if you're trying to build a solution that is extensible, or not geographically confined. And then the SOM, this would be your beachhead market, right? This is the market where you will prove that, in fact, your solution is saleable. Older adults diagnosed with ADHD seeking help in Baltimore City. So very, very specific. So these are people that are not only diagnosed, they're actually looking for help. Why do you want to go after that market? Because they're looking for help. Because if you have a solution, they are your first customers, right? You're not trying to convince them to buy. You have something that they need, and all you have to do is convince them that your solution is good enough for them to try it. So this is how you sort of break down your market, and your financial estimates on your top line would be that green circle right there, right? That's your beachhead market, the one that you're going to go after right off the bat with your minimal viable product. Okay, now you have to the extent that you can, try to quantify it. So here I've attempted to quantify, what the TAM is, right? So in this case, it's 0.23% of the older adult population that epidemiologically, are estimated to have ADHD. The 122 million older adults. I can't remember where these numbers are coming from. I think it's 2022, so fairly recent. And then in this case, I have an app, not me, but in this example, there's an app that they were hoping to sell for $61 subscription in a year, and that's your potential total market size is $1.7 billion, right? That's very generous, and so you might say, that's not very credible. Maybe $61 a year, maybe too much. So I'm going to have to do a bit of market research on willingness to pay to figure that number a little bit better. And then, the growth rate is really the rate at which your population is aging, above 50. Okay. So as I said, some of these things you have to do more research to nail the numbers down, but you can see how it's really important to quantify that number, because that tells you the potential size of your venture. That tells the venture capitalist whether you're investable or not, given their risk profile, given what they require in terms of return. Okay. And then I'll just run through the rest fairly quickly, because the rest of it is sort of very well, very clear, fairly objective. So the next few slides will be fairly quick. I'm going to try to give us a bit more time on the business model piece, because that's also another area that can be quite challenging for some. Not challenging in the sense that it's difficult. It simply requires, a lot more thinking, a lot more research to nail it. So the next segment of the pitch will be the technology. So what's the difference between the technology and the solution? So the solution is simply an explanation of what you are going to do, or what your product or your service is to solve the problem, right? So the technology is the guts, like how does it work, right? So if you think of the solution as what is it? Is it a thing, a service, a piece of software, a process model, right? The technology is how do we actually make this thing, like what are the guts? What is it? How does it actually work, right? Now, again, for the purposes of a pitch, and really also for intellectual property concerns, you don't necessarily want to show, the deep technical details. Unless you are maybe in your third meeting and you're under an NDA with your investor. And at that point, typically the investor is going to want to see data, right? But you're under an NDA, you're fine. But if this is, in a pitch, in a public pitch, you want to sort of have enough description in there about, so let's say this is an AI embedded device. So what is the technology? So you've got AI, Maybe you have some edge computing. You have a chip that's built into that's built next to the sensor that processes some information. Maybe it uploads something to the cloud or is disconnected from the cloud. So you want to give enough technical detail that your solution looks plausible, right? It's not, oh, I'm going to invent a device to teleport. That's a great thing, but there's probably no physics that currently allows that to happen. Although there's some experiments in quantum mechanics that might, support it. But the point is, you want to show what's actually in the guts, enough of the guts that it conveys the idea that this thing that you're doing actually can be done. And more importantly, you actually have people working on it, right? You also want to talk about a little bit about intellectual property, because the technology, if you're talking about, let's say, a product, right, or a design, you really ought to have intellectual property. Very few investors are going to invest without some protection because they're taking a risk and they want to make sure, whether it's going to be enforceable or not. But if you have protection, it lowers the risk of the investment. It lowers the risk that the investment is going to be obviated by some other company jumping in and doing what you're doing faster with more resources. Again, use images, videos, visuals. Don't have long, lengthy written explanation. I've seen some pictures where people copy and pasted, the patent, the patent award. I mean, I guess that's sort of impressive, but no one's going to read the patent, right? But you can say, we've got a patent and this is what it does, right? So the competition, I mentioned that very briefly. The competition is basically trying to convey the idea that, number one, who you're competing against, but more importantly, why are you better, or why you are better than the competition, right? So now the competitor is not same as the market. The market are your consumers. So the market is how many people are there that are willing to use the product, that are willing to pay the price that you're asking for. Competitors are all these other companies that are trying to solve the same problem as you. Maybe they use a different solution, or maybe they use a very similar solution, but these are competitors they're companies that are trying to do the same thing as you. It's also important to understand your competitors, especially your most important competitors. Why? Oftentimes, they can become strategic investors. So your competitors can very quickly, with a flip of the story, become your most powerful allies and your most enthusiastic strategic competitors, strategic investors, especially if you've got something that they've been working on that they have, for whatever reason, haven't been successful, or something that they haven't thought about but could actually add value, to their underlying technology. So this is sort of an important slide, especially if you have done your market research and you have identified potential strategic investors. So this is what a typical competitor slide looks like, right? So you've got competitors, they could be the product names in there, and then you have different features, right? So this is very generic. Obviously, this is not terribly informative, but you want to think about the various features of your solution set, right? And how it compares with what your competitor offers to show that in fact you are superior on some dimension. You might not be superior on every dimension, but you have to show you have some kind of an advantage. That gives you the ability to make a case to the marketplace that you can actually sell the thing. Okay. All right, so let's talk about the team. By the way, this slide is also very important, especially if you're early stage, because most investors understand that the odds of success for an early stage in invention or early stage venture, the odds of success are low to begin with, right? So what are they actually betting on? Well, if you have a really cool solution, they'll bet on that, but they're really betting on you, right? So in any investment, I would argue at least half of the decision for the investment is going to be based on the team. So what does this team bring to the table? Because if it's not this product, it could be another product in the future. And investors are interested in building a relationship with the team. So it's the scientist, the clinician, the engineer, the business person, with experience. So you want to talk about, for the team, not just their roles and their titles, right? But what are they actually doing? What are they bringing to the table? Their skills, their experience, their responsibilities. So one sentence, very precise press A bios. Okay, this person is on this team because that's what they contribute, and their presence on the team makes the odds of getting to the next milestone much better. That's why your team is there, right? It isn't just to show that you've got a whole bunch of people working on this thing. Everybody has a very specific contribution to make. And so you want to be very judicious about who you put on this picture. I will tell you that the people that are helping you with your venture, that are working with you, is going to be a far bigger group than who you end up putting on this picture. Okay. So, like, don't put everybody in your lab on this picture. I see that a lot. It's like, okay, there are 15 people in a lab. No, they're not all working on this thing. They might contribute a little bit, Who are the key people? Like, who are the 2 persons in your lab, right, that will either make or break this? And if they are absent or they're not working on this thing, it's going to slow you down, or it's going to cancel the program. Okay, so the next piece is also fairly important, which is the business model. So the business model basically says 2 things. There are 2 pieces to every business model. All the activities involved in the making of something, and all of the activities involved in the selling of something. So making and selling, right? Question from Pamela. How important is it for the graphics to be very slick and polished? Very important, because remember, 60-second ad. 60-second Super Bowl ad, remember that. Okay, it is very, very important. So spend a bit of time on it, do post-production. By the way, there is no reason why you cannot record the narration. Now, in the live pitch event, you have to pitch live, right? But if you are going to pitch in a Zoom, you should write out the script, and you should practice it and read the script and do it with conviction, right? There's no reason why you can't use the advantage of being behind the screen to actually, basically do it teleprompter style, okay? But slick and compelling and attention grabbing, absolutely important. Because remember, you are competing in a very crowded market space. If you have an idea, if you have identified a problem, 10 other people have done it. Why are you the one that's going to get the money to do it, right? Because you're making a convincing case, okay? So it's very much, even if there's the science behind it, it's very much consumer oriented. All right, so you might have seen this before, the business model canvas. This is simply another way of saying all the things that you have to do, the resources you need to make something, and all the things you have to do and the resources you need to sell something. That's your business model. It's not that complicated. What is complicated is what goes into all these boxes, right? So this basically needs research, right? Remember I talked about a value proposition. The value proposition, which is the solution that addresses that problem precisely for a well-defined audience, that lies in the center of your business model. Everything has to add up to the delivery of the value proposition. So everything that you're making and that you're selling to the customer delivers the value proposition. And then the bottom part of the business model canvas is basically the numbers, the financial resources that are reflecting what you need to do to make and sell stuff. All right. So here's the question. What problem are you solving? And what customer segment you think is most likely to pay for your solution? Right. And then the second question is, based on everything that you know where you are in your journey right now, what's the first thing that you need? Information, activity, resource to begin building the solution. All right. So 2 things. What customer segment will most likely pay for the most for your solution? You might have to think about that. You may have not thought about that at this point. Maybe you may have. Share that. And then the next big thing you have to do to move it forward towards the solution. Building a prototype, building a wireframe, whatever it is. It could be information. It could be something you have to do. It could be a resource, some person you need, money, what have you. Okay, so but you sort of understand, this exercise, because without answering that first question, which is who is your customer segment, is really tough to build a business model, right? It's tough to figure out what you're going to make for them and therefore what you need to make. And if you don't know what to make for them and whether they're willing to pay for it, then you don't really have a revenue model. So this is actually quite important. Or the I-Core, that's a good program. There are many other sort of similar programs like that. But look for that, right? In your universities, wherever you're working at, look for those kinds of opportunities. And maybe you don't do it. Maybe you get a trainee to do it. Maybe you get a postdoc to do it. Somebody on the team has to do it. Okay. All right. Let's quickly cover the next three, which is probably for many of you, you're not there yet, but it's really important to think about because you will be asked this question at some point, maybe not in this pitch, but down the line, which is how are you going to get your first customer? Very critical. As I said, if you can get your first customer, you can get your second customer. Then the question is how many more of them are there out there? And then that's really a question of growth, right? Which is a separate question. But the key is how am I going to get my first customer? How am I going to get the first paying customer, not someone who is willing to use the thing for free? Okay, so you can talk about marketing channels. You can talk about how you're going to the process of acquiring a customer. Again, I think using images and videos is really important. So you can illustrate that not with a lot of words, but with, let's say, a customer acquisition journey. How do you build awareness? How do you build engagement? How do you get your customer to try something? Oftentimes they have to try. Not always they can do that, right? But to the extent that you can get your customer to try, even conceptually, think about how your solution can fit into their needs. And then how are you going to get to actually adopt and then to pay for it? And then your retention program. So all of these things are sort of different ways of acquiring your customers, your first customer, and then keeping them and then finding the next customer. So now the next one, of course, is your financials. So now, I like to say that if you have a well-defined business and a business model, you should be able to come up with the financials fairly easily because everything that you do, all your activities, your resources, that has to be reflected in your financial statement. For a startup, really the only financial statement you need is your cash flow statement. Again, this is not something that you need to think about now. You do need to think about how much money you need for each step of your development cycle. Okay, so while it may not come about in a formal cash flow projection, you must have some idea of what you're going to need to build your prototype, to write the first algorithm, at least how much you're going to need to pay for a coder to do this, or an engineer, or a designer. All right, so you need to put together basically a resource plan, and that typically would become part of your cash flow statement. And so these are all the different elements that investors look for. And the reason they want to know this, especially something like the contribution margin, is whether your business, when it's fully matured, is truly sustainable. Can you actually make money, and can you make money in a way that allows you to keep making product, keep providing the service in order to make more money, in order to serve more customers. Okay. And of course, the other piece that is quite important are the key assumptions and risk areas. And that is where you do your research. That's where your research shows up. Here is my market estimation, and the estimation depends on these key assumptions. And if these assumptions are violated, then my market size is going to be X. So that's the type of conversation that you're going to have if you are meeting with an investor. Okay, those are the questions they will ask you. All right, and then as far as there was a question about videos, yeah, you want to show product videos because that's actually a very good way of showing your solution, right? Go back to the solution slide, but you want to make it so that it's seamless in the presentation. So if you can embed it into your presentation, that's better. If you have to click out, say to a YouTube, it gets a little bit clunky. So that's more like presentation. And then finally, the final slide, sometimes it could be the first slide, is how much money are you asking for? What are you giving up in exchange? And how are you going to use the money? Very, very important. So in the context of this pitch, if you win the money, what are you going to use it for, right? How is it going to help you advance your technology? For AARP, that's going to be very important because they're going to, presumably, you're going to pitch to be admitted to the accelerator program. The accelerator program doesn't simply come with expert advice. It comes with exposure to potential investors as well. So you need to have a very clear idea of how much money you need from an investor in order to move your product forward. All right, some do's and don'ts. I've said a lot of these things. I think the key is, yes, it needs to be slick because you're trying to tell a story to engage people emotionally. I mean, even though you're trying to build a product to solve a clinical problem or a service problem, you're trying to get people to take a risk with you, right? Because there are other people trying to build the same thing, trying to do the same thing. So why is your idea better than others? Some of it is technical superiority, true enough, but it has to reach the investor emotionally. We invest with our heads, but we stay committed with our hearts. And that's really the way it works, even in the venture capital world, and it's important that you build a relationship with them because most venture capitalists, they're really interested in a relationship. They know that your venture, the odds of success are not high to begin with, but they want to be able to bet on you and feel good about that. Okay. First impressions are very important. Make sure when you're doing a presentation, especially if you have several people doing different pieces, that they use the same background, that you have a consistent look and feel. This is basically sort of blocking and tackling, presentation 101. All right. Make sure you do post-production. If you're going to record the presentation, make sure that the transitions are smooth, there are no hiccups, the volume is equalized across speakers, simple things like that, right? And you know all this because when you listen back to your own presentation, you can probably see all the flaws in it. And then finally, visual heavy, text light. That's sort of the bottom line. Visual heavy, text light. For this competition, since you are going to be recording this, write a script, read it out, practice it, do post-production. You have the luxury of doing that. I would spend time doing this. If you get a good undergraduate student, these guys are really good at this kind of stuff. Get them to work actually on the mechanics of the actual presentation itself, right? And there are lots of good software out there. There's AI software, ironically, that will help you pull together a really slick presentation. There's really no excuse for a poor presentation in this world that we live in today. All right. So finally, some next steps. Pitch application opens December 8th. Okay. The deadline is January 14th at noon. And you will be sent an email with the links, the application link to fill up the form, to upload your deck. Remember, it's 5 minutes max, 10 slides max. Use that judiciously. And remember, your first draft should not be your final draft, right? Draft the thing, sit on it over time, and you can start working on it tomorrow, really, right? Get your team involved, get their right ideas. As I said, if you can get a good undergraduate student, they're really good at this stuff. I mean, that's the reason why TikTok is so valuable. I don't understand it, but they obviously do, and they know how to, get the attention of skeptical viewers, because that's what they're competing on TikTok. All right. The finalists will be notified on February 19th. So we will go through a competitive evaluation process internally among the 3 AITCs and the A2 Collective head office. And then we will let you know. And then the live pitch is going to be March 20th. And you will be connected. If you get picked to be a finalist, you will be connected to BHI that will give you even more mentoring, specific one-on-one mentoring on preparing the live pitch. All right. So lots of resources, lots of backing, lots of support. We want you to be successful. In a way, your success is our success. There's a convergence of incentives here. Now, in terms of the AgeTech Accelerator eligibility, I won't go into this in great depth. They're looking for certain kinds of products and services. So your particular product and service may not meet that criteria, which is fine. There are lots of opportunities to pitch around the country. And we're happy to help you prepare for pitches. University of Texas, Austin has a 50,000K pitch, I think. There are lots of these opportunities. the Boston area has these pitches all the time. MIT has pitches that are open to the public. I know USC has an annual pitch competition, and you can spend a lot of time doing this, so pick it judiciously. Your products and services must at least be at the minimal viable product stage. So you have to have something that sort of works. Okay, that's what they're looking for. And then here are the review criteria. We will use a similar review criteria, for this competition. It's pretty generic, really. So we're going to look at your team and the founder, experience, background. We're going to look at how you define the market opportunity, how big it is, how fast it's growing. Again, it doesn't have to be big and fast growing, but it needs to be lucrative, right? You need to be able to make money that is sustainable so you can keep serving patients, keep doing what you're doing, and not have to constantly get cash infusions to keep the business going. We will be looking at the product. There'll be sort of a bunch of different criteria in terms of unique value proposition, whether you actually have a product that's ready, how are you going to make the product? Can you sell it? Is there a clearly defined way of selling the product through a marketing channel? So, and then of course, traction, I talked about that, it's really important. And then the quality of the pitch deck, okay? Storytelling, etc. So this is very obvious. I mean, but you do have to practice it, and you do have to view it and be sort of self-critical in order to put a really good high quality pitch deck together. So here are the key sort of, I would say, for the AARP slide, even for us, for the deck, you want to focus on these. The other stuff is also important. Like if you're going to lead with the technology and you have something very unique, just make a case for it. But again, make sure that it is tuned for the smart but non-technical audience, right? So that's the way I would put it. All right. So that's all I've got. And, I appreciate your patience. I took more time than actually I planned. But if you have any other questions, I invite you to submit that to the coordinating office at the A2, and we will field the questions from them. So either us at Hopkins or UMass or Penn, we all have people, depending on your specific question, we can help you answer those questions. And again, feel free to reach out to us. We are all accessible. All the 3 centers, right, are actually accessible by email. And if you go to our websites, we have contact information there as well.
Hey, I want to thank Phil. Thank you so much for leading this great training session today. And I want to thank you all for staying with us to the very end. A reminder to register for the Reframe Aging training series that begins next week. If you have any questions, please reach out again to Alice, who you will be hearing from by email about all of the different training streams that we are providing leading up to the symposium. So thank you very much.
Take care. Have a great day, everyone.
Thank you.